Well, did you know that a state rule allows hospitals during times of crisis to fill out a waiver, which allows them to increase their workload by about 50%? Hospitals can increase the ICU nurse-to-patient ratio from 1 nurse to every 2 patients to 1 nurse to every 3 patients. It's increasing the workload by 1 patient, but as inewsource and KPBS found in their massive investigation, it really can mean the difference between life and death. Now, this happened at more than 200 hospitals across California throughout the pandemic, but our investigative partner inewsource found that some hospitals were approved for waivers without reporting that they were actually under stress. Assistant editor and senior investigative reporter Brad Racino joins us now to break this all down for us. Brad, thanks for joining us, man. Pretty complex stuff here. Can you tell us what has to happen for a hospital to even apply for one of these waivers?
Sure. So this is kind of a last resort. Hospitals have to show that they've exhausted all other alternatives like rescheduling elective procedures, transferring patients, and creating clinics for non-emergency cases. But the reporters on this story, Joe Castellano and Taryn Mento, found that that wasn't the case for a lot of the hospitals that received these waivers. In fact, over half the hospitals that have received at least one waiver did so without first rescheduling non-emergency procedures, a third hadn't transferred patients to other facilities, and about 3/4 of them hadn't established clinics to take over their non-emergency cases.
So the big question then, did any hospitals here in San Diego County need to apply for these waivers?
We know of about at least 15 of the county's hospitals have been granted staffing waivers. Now, most of them wouldn't talk to us about it, but we did speak with officials at Scripps Health and Rady Children's Hospital. They said they applied for these waivers proactively because they anticipated an increase in COVID cases. In addition, Palomar Medical Center in Escondido applied for and received a waiver, and that was after the hospital had laid off more than 300 employees in April. So one of the nurses there told us the waiver just increased workloads for nurses, which in turn posed some pretty significant risk to the patients.
Boy, that really is concerning for sure, adding a lot more stress on these workers. I mean, I think we've all talked to nurses and doctors who quite frankly are just burned out. I mean, they've been working these long, stressful shifts, and now to hear something like this is happening where they were asked to do even more when maybe they didn't need to. I mean, it's kind of like they're kicking them when they're down.
Yeah, I mean, we spoke to them too, and they're stressed, and as you said, and rightfully so. I mean, studies have found that as nursing levels decrease, patient hospital stays get longer, and patient feedback tends to get more negative. And we spoke to one nurse, his name was Brian Telfort. He is a nurse at LA's Kaiser Permanente Medical Center. He said that once his hospital was granted a staffing waiver in December, patient and worker safety was compromised. And here's a short clip of him.
And again, a lot of us are stressed, not just because we're working hard, but because we care about the anxiety level of me missing a treatment for you through the roof. The anxiety level of me messing up and possibly causing your life, that's difficult.
I mean, you hear him speak there, and what patient wants to be in a hospital knowing that the doctors and nurses working on them are just exhausted?
Yeah, it's a pretty bad situation. And, you know, some nurse unions have said there are measures that could be taken to help, but their hospitals, for whatever reason, just aren't doing them. They say nurse managers could take on more patients to help ease the burden, or hospitals could downgrade less serious cases out of the ICU. But for whatever reason, at least those nurses say those things just aren't happening.
All right, well, we're glad you and inewsource, KPBS, all on top of this. Keep us informed, Brad. Thank you.